Good morning, everybody. Welcome to Pediatric Grand Rounds on this last Wednesday in February. It'd be the 26th, which I think everybody knows is National Pistachio Day. It's National Tell Someone a Fairy Tale Day. And it's, of course, Set a Good Example Day, which we all do by coming to Grand Rounds. Thank you, everybody who's in Davis Auditorium. Good morning to everybody who is out in Zoom land, particularly on a school vacation. Actually, last week was school vacation week in New York. It's school vacation week in Vermont, but it's nice to have everybody joining us this morning for a very special Pediatric Grand Rounds. I'm Louis. First, I keep an eye on what happens at the podium. And today, my co-pilot, Seher Bruce, who is chief resident in waiting. Well, Dr. Blanchette is on the road, so she's working the keyboards today. So nice. Thank you, Sarah, for doing that. This morning is a very special Grand Rounds. It is part of the Laura Mann Integrative Healthcare Lecture Series, which, if you don't know, brings throughout the year experts in the field of integrative health together to educate and uplift our community. And they've been doing this for nearly 15 years. This is presented as well by the Osher Center for Integrative Health at UVM, who helps bring music therapy to our children's hospital. And these events really are part of the Osher Center's mission to advance whole person integrative health through education, clinical care, research, and policy. These talks are always, as are all our Grand Rounds, are free. They are open to the public, and the Laura Mann Lecture Series occurs in various departments' Grand Rounds, and today Pediatrics is the home for this particular talk, which I think everybody is looking forward to. As I said, it's great to see so many people again gathering in Davis as well as out in Zoom land. We're going to talk about medical music therapy this morning, and I can't think of two better people to tune up for us, so to speak, and hit the right notes on this particular topic. I'm going to introduce them, and they're going to tag team together, is my understanding, correct? So let me start by telling you that we have today with us Danica Cunningham and Maggie Connors. Danica got her bachelor's in music and psychology at St. Lawrence. She then went to Colorado State, where she got her master's in music therapy. She did her internship at Colorado Children's Hospital in Denver, and then saw the proverbial say goodbye to the Rockies and hello to the Green Mountains, and came here, where she has basically brought music therapy to our region in a variety of settings, from working in a private practice, but she merged with the Osher Center, which was great for us because it brought her to our children's hospital, where she continues to provide music therapy to our pediatric patients on an ongoing patient basis. If you haven't seen Danica, where have you been? But she is up there regularly, again, celebrating the role of music therapy to bring out the strengths and resiliencies in our patients. So it is wonderful to have you here today. And partnering Danica is Maggie Connors, who got her music therapy degree at the College of Worcester in Worcester, Ohio, not Worcester, Massachusetts, just to get that. Actually, it's Worcester. She completed her training, an internship, and then further work in music therapy at University of Pittsburgh in the Western Psychiatric Institute at University of Pittsburgh and their clinic, and then went to Pittsburgh Children's, where she interned and got into the pediatric arm of music therapy. In 2017, she saw also, I guess you got the Allegheny area in Pittsburgh, but the proverbial Green Mountains, and then came here as a board certified music therapist for first a private practice, but then basically again in the Chittenden and Franklin County area started to do work for a number of organizations and agencies. And we are so fortunate that she has brought her talents to our children's hospital as well. Her focus is on bringing music to pediatric palliative care, inpatient pediatrics, school-based music therapy. And a year or two ago, she completed a NICU music therapy certificate training program from Florida State. Maggie also has a national role as national co-chair for the Professional Advocacy Committee, we need that, of the American Music Therapy Association, and is a member of the Vermont State Music Therapy Task Force to basically advocate for bringing music therapy basically by qualified professionals to where we need it most. And certainly with our children, we need it most. So both of them are going to take us through, I love the title, From Rock and Roll to Lullabies, Medical Music Therapy Supporting Whole Person Care at our Children's Hospital. Please welcome Danica and Maggie. Thank you so much for being
Good morning. It's early. Yeah. Time to wake up. Woo! Feels good to move a little bit. Reach out my hand. Little wiggle here, little wiggle there. You're on Zoom, wherever you are. It's okay to move and groove. What a great way to start the morning, to be here with you all and to wake up with a little beat in our step and give us a little motivation to activate our thinking brains, excite our bodies, and to move to the beat. You might have noticed, I can't help myself but start dancing when I hear a song that I love, especially one that brings up memories of maybe movie montages or times of happiness or good memories. Through entrainment and emotional responses to music, we have a way to tap into our bodies and our minds in a way that's natural and ingrained in who we are as humans. Good morning and welcome. My name is Danica Cunningham and this is Maggie Connors. We are so happy to be here to let you know a little bit more about how the mechanisms of music therapy work, the research behind them, and the ways that we use it in clinical work day to day. We're so happy to be here on behalf of the Osher Center, and let's dive in.
We really dove in. We'll go back a little, dip our toes in.
Okay, here we go. So what is music therapy? It is an evidence-based clinical practice of using music to achieve non-musical goals. In other words, we're involving our understanding of how rhythm, melody, harmony, and personal musical preference can help us achieve goals that are physical, social, emotional, cognitive, and harnessing these aspects together to create a therapeutic experience. Music therapy is adaptable, accessible, inclusive, and a low-cost alternative to healing that Dr. First and the pediatric team on Baird 5 in the PICU get to utilize 4 days a week for 2.5 hours. I'm so happy to be here today because it's a long road to get to become a music therapist. As Dr. First explained, I received my music therapy master's degree at Colorado State. After completing those classes, I completed my internship at Children's Hospital in Denver, where I learned firsthand the impact that I was able to have on working with children in the medical setting. Starting to understand the power that music holds in this way created a real fire in my belly to bring it to practice and to do it in a way that felt most like myself. So I knew that music therapy was right for me, sat for the board exam, and got my credentials as a music therapist board certified. So that's going to be the letters you see next to our name. And every 5 years, we work towards continuing education credits to keep up to date with research and understanding our niche. And through this process, we work under these specific standards to make sure that our care is ethical and at the highest level of efficacy. So music has always been an important part in my life and gotten me through milestones from infancy till now. But I guess I'm not the only one. Music has been a part of human culture since the prehistoric times, with instruments dating back ages and ages. There's evidence that music aided in healing rituals, rites of passage, and other markers of success and growth. if you think of any birthday, wedding, or funeral, you know that there's music, specific music that's associated with it. So there's a clear direction telling us that music is inherently human, and that across cultures, centuries, languages, we all come together through music. In this way, it only makes sense to continue down our timeline. And World War I and II signified a big turning point for music therapy as a profession. When veterans returned home, there was an increase in state facility and VA hospital admissions. And to support this, there were volunteer musicians who were coming in and providing music. And doctors, hospital staff, and musicians were all noticing a behavior change with this addition of music. Patients were more compliant. They were having better experiences, and this led to, in the 40s, establishing our first basis of curriculum around becoming trained as a musician who's using music as therapy. The National Association for Music Therapy then formed, and registered music therapists became established. So this increase in need for this position led to an increase in validity and coming to terms with what really is happening here that we're noticing with patients. So it wasn't, so this first publication of Music Therapy Journal points us in the direction that now that we've seen some changes happening, we need to figure out why. So research and evidence-based practices and understanding the brain functions of how music is processed really started to come into play and helped us create a certification program to ensure that those who were calling themselves music therapists were working at a standard that was informed by not only their musical understanding, but their clinical understanding as well. We've got our unification process, so now things are really becoming unified, and in more recent times, all this work has led to a need for as much advocacy as possible and recognition from state and public organizations.
So now a little history of music therapy here at the Vermont Children's Hospital. The services here are made possible by philanthropic gifts and grants. It started in 2015. We had 2 hours of weekly music therapy service by a different contract music therapist. In 2020, we went on a pause in March due to the COVID-19 pandemic. In 2021, that June, we were able to resume services, very exciting. And we're still at 2 hours a week. But I will say nurses were like, oh my gosh, you're back. Like, yes, which was very exciting. In 2023, we were able to expand to 5 hours a week. And that following February in 2024, we were able to add our fabulous second music therapist, Danica, and expand to 10 hours a week, which means we're celebrating 10 years of music therapy at Vermont Children's Hospital, which is very exciting. And I didn't quite realize it until I was putting this slide together. I was like, oh my gosh, 2015 was a little before my time here. So I'm really excited to announce that. And I think this is a great culmination and continuance of our work by giving this presentation.
Thanks, Maggie. So let's get into what music therapy looks like day to day. From a broader perspective, we are looking at the approach, process, and methods that Maggie and I get to work. And to understand this, it's important to know that one music therapy session with one client might look completely different to a music therapy session with another. It's highly individualized and structured to support the needs and strengths of the individual person. We get to work with our interdisciplinary team to achieve similar therapeutic goals. But the way we get to do it is through building rapport with our patients. Active patient participation is key for this. And so at whatever level they're able to engage, we're using every tool in our toolbox to promote as much engagement as possible. This is a buy-in for the patient to be an active participant in their healing in a way that is motivating and accessible. And you'll see later, procedural support is a really powerful tool that we get to embark on, as well as the effects of music are so motivating and positive in nature that sometimes we get to sneak in harder tasks through the musical context. When we see a patient, we do a quick assessment of what we're observing: facial affect, body positioning, energy levels, the makeup of who's in the room, and almost on an intuitive level, just picking up on what is needed in this particular moment. We plan for how we're going to approach our music intervention, and that might look like improvisation, songwriting, drumming, singing, playing instruments, relaxation. It might be active making, or it might be more passive. We have a lot of infants on the floor who are in a place to receive music and let their physiological responses do the responding, more than making choices and so on. The beautiful thing about using music as our tool is it is predictable, repetitive, and structured. So in this way, we get to continuously evaluate and adapt according to what we're noticing in the moment. With one pass of a verse and chorus, we get to see what's working, what's not, and on the second round, maybe make adaptations and maybe up the stakes a little bit, or make it a little more easy to participate. And it's a continual awareness and care that goes into being present with our patients. Excuse me. So I kind of gave you this overview of what's going to happen in a session, but it's hard to understand what that actually looks like. So I'm going to try to take you through what a typical 2.5-hour afternoon looks like for Maggie and I. Arriving on Baird 5 is one of my favorite moments, with a guitar strapped on my back and my homemade music therapy jacket. I know that I get to open the doors and greet all of the wonderful, wonderful pediatric staff. It's been a pleasure to get to know them and to work with them in ways that feels supportive to help them get their jobs done, but also just create a space of positive energy and connectedness. We get a quick rundown of who is on the floor that particular day with child life, and from that place, we might get some staff referrals from nurses and make a quick determination if there's a priority for one patient over another, and then it's time to set up our instruments. I personally like to use a pushy cart, and so I load up my cart with guitar, keyboards, drums, tambourine, egg shakers, any instrument that doesn't require you needing to know how to play it to be able to play it. We want the biggest bang for our buck, and I'm talking about banging on the drums. Once we're all set up and tuned, it's time to go visit some patients. Sessions might happen in their rooms, it might happen in the hallway, or it might happen in the common spaces. The number one skill that I use the most on the floor is improvisation. So if the opportunity presents itself with a patient who's needs a movement break and walking around the halls, I'm going to take that as an opportunity to incorporate a musical intervention to enhance the patient's current state. There's no telling of how long or how short a session might go on. It's really just based on where the patient is giving me the feedback. Sometimes it's a quick 10, 15 minute session. Other times it can go up to 40, 45 minutes if there's a really strong connection and the music is motivating in a way that's creating some big behavior changes and healing. So on a given day, there might be 15 pediatric patients. If I visit the first 4 of them and they all say yes to have music therapy, that means I've used up my time and I don't get a chance to see the rest of the patient list. However, as you all know, the dynamic nature of being in the hospital, there's always something going on. So I might go to a door and they might be sleeping in a meeting or out of their rooms. There is something really special about the split second where I open the door of a patient's room. They're one place at the hospital that they call their own. And there's an opportunity for me to become part of their story. And the feeling that comes over me when I open the door and have my guitar in my hand and say, "Hey, I'm Danica, I'm the music therapist. Would you like to play some music today?" It can either change the story of a family's experience at the hospital, or if they say no, that's going to change their experience. However, there is so much beauty in declining services as well. So in some of our patients, we have reoccurring admissions with oncology and other medical conditions, and in a place where they don't have a lot of choices to make and autonomy, being able to decline services is a powerful and healing opportunity. So that process is going to happen as many times as is allotted, depending on the specific terms of the day. But by the end of the day, we are trying to get as many patients offered the opportunity for music therapy on Baird 5 and in the PICU. And we are making sure to tally the amount of people who are receiving it, declining it, sleeping out of their rooms, and other factors that might help us determine the best way to use our resources to be as effective as possible. Now it's time for us to discuss 4 major populations that we see on the floor and how music supports their goals. First, I'm going to be talking about our mental health populations. Music therapy gets to create a container that is safe and supportive to our patients who are often withdrawn, have difficulty expressing emotions, are trying to build coping skills, or becoming medically stable. With the recent COVID-19 and other factors of our current day, the number of pediatric patients who are being admitted for medical stabilization are in this interim period. They're on the floor awaiting psychiatric facility placement. And so by being able to support through music therapy during this time that they're waiting for their placement, we not only Maggie and I, but in this 2023 study, there are an 88.5% of improved behavior states and similar numbers of higher levels of engagement after music therapy services while awaiting placement. I get to know a patient as naturally as possible. Maybe talk about ways that music is used in their lives at home or at school. Maybe what their favorite artists are or types of music, and from that place, we get to build an experience. Often with our teenagers who are maybe suicidal ideation or eating disorders, we are able to come together in a common way of, oh, you love hip hop and rap? Oh, so do I. Like, let's listen to it. And so using the recorded music as an entry point is a really safe and accessible way to get a patient involved, and then to slowly work ourselves away from the recording and create a live music experience through beat making or playing the chords and singing the lyrics together, and making sure that there's time for processing that experience, to build all of these skills. And our parent and family involvement is a beautiful addition to giving families a chance to come together over a common successful experience during a time when there's a lot of question marks and a lot of fear and a lot of insecurity.
I'm going to be talking a little bit about procedural support. In this Yinger 2016 article, they looked at music therapy as a procedural support for kids receiving vaccinations. And they found higher rates of coping behaviors with the kids, lower rates of distress behaviors compared to standard care, as well as decreased rates in parent distress promoting behaviors. And then parents also reported their child is less stressed when receiving music therapy as procedural support, and it improved their view of the facility. In practice, this might look like in the hospital, IV removals or placing a new IV, dressing changes, EEG placement and removal has kind of been an experience that both Danica and I have had that has been a really positive addition that we're happy to offer, and then NG placements as well. And what that can look like in a lot of different ways. So procedural support is kind of like this overarching idea, and that may look like reducing stress. Sometimes that's before the procedure when they're waiting. Maybe they're waiting to go down to the OR or they're going to IR. And so we're able to go in, maybe they're NPO, which makes everyone a little bit grumpy. And so we're able to go in and have a session, reduce some of that stress and anxiety, provide some distraction from waiting for what's coming. And then we're also able to kind of change the environment in the room. I know we've gotten a lot of comments like, oh my gosh, that was the calmest this room has been, or like, oh my gosh, your music really helped me relax. Even if the kid was still upset, parents have commented like, this has helped me manage my feelings around this procedure. So really we're looking at, the patient and the family. It's this whole kind of unit. And then nurses always comment to like, oh gosh, like this really helped with this procedure. We can also use it in recovery. So sometimes they just need to do the procedure, and the best time to use music therapy is after. So this might look like procedural support for our infants. We don't necessarily want to always be introducing a music stimuli when they're getting a painful procedure like a poke. We want to kind of avoid any associations. So afterwards, it might look like returning to baseline quicker because we're able to provide some relaxing music, or the parents able to have a little cuddle and sing to them. So it looks very different in different ways. And it's up to the music therapist using our clinical judgment to figure out what makes the most sense. It's also a little bit an intervention of opportunity. It has to be right. They have to be getting the procedure while we're on the floor. And then nurses have been really wonderful about kind of giving us a heads up, like, hey, this is happening in room 25. Like, are you going to be around? And so we're able to kind of coordinate when possible to be able to provide these services. We also provide music therapy with patients with serious illness, and this could look like a kid with a hematology diagnosis, oncology, maybe they have a genetic disorder, maybe they have a really serious epilepsy disorder or a combination, and they're medically complex. In the Delaney 2023 article, was looking at the association between music therapy, pain, and heart rate while children received palliative care, and they found a statistically significant decrease in pain scores and heart rate. And they also did a thematic analysis with parents, and they found that parents often talked about the increased opportunities to feel joy and the impacts on the physiological state. I think this kind of gets at this idea of that biopsychosocial model, right? We're looking at how is this impacting families from the physiological, biological side? What's the mental health and that psychological impact, and then what's the social impact for the family? The Not 2022 article looks at this. They're not, they do some case studies, but really they're looking at how does music therapy address the psychosocial standards. And they found that music therapy within our standards of practice and our procedures addresses 9 of the 15 psychosocial standards. And it can be an opportunity to provide personalized and comprehensive psychosocial care for patients. So this might look like a lot of different things. For example, a 2-year-old patient and a family having received a new cancer diagnosis. One of the things that Danica and I think a lot about is what songs do you pick? Sometimes we go in and patients are like, I don't care, play me whatever you want. Like I cannot make one more decision, just play something. And so it can be part of Danica and I's job to figure out, well, like what kind of song do we bring to someone that's just heard really terrible news? And a song that I like to use to provide patients with support is a song called Bird by Joe Crookson. And it goes a little bit like this. Change isn't easy, change can be hard. Fear comes in and it can tear you apart. How we gonna make it? What are we gonna do? How we gonna make it when change comes through? We'll take it bird by bird, a little at a time, take it bird by bird and stone by stone. A little at a time, take it stone by stone. And there are other verses, but something that Danica and I are always thinking about is what messages are in the song. Maybe we're not going in with this super happy song. We have to come in with songs that are supportive and acknowledge the reality that these families are facing. Another example, and this is where we get to give a little shout out to the Pediatric Advanced Care team. These wonderful professionals have been so supportive of our work in pediatrics. They are the pediatric palliative care team here at the hospital, and we have been really fortunate to be able to work closely with them in instances like this is like a generated example. Perhaps an 8-year-old patient with a rare genetic disorder who is being discharged home on hospice. And so one of the services that we provide are heartbeat recordings. So this was developed by Brian Schreck. I'm a music therapist. I think he's been a couple different places, but I think when he was down in Kentucky. And one of the things we can do is we can go in and use a Bluetooth stethoscope and a microphone to record a patient's heartbeat. And then the music therapists will do a little bit of editing and loop that heartbeat. Sometimes patients and families request or are offered a song, so we can record a song of their choosing. We can adjust the lyrics and make it personalized. And we've also been able to do this in the prenatal space, so working with families who received a fetal diagnosis, and PACT will kind of call us and we'll talk through, like, is it appropriate to offer this service to the family? Can we coordinate this? And then we're able to take the heartbeat off of a Doppler and do this same sort of procedure and kind of editing so that we can provide these patients with a really wonderful memory of their kid and we can put them in reporters and stuffed animals, and there's some different kind of projects and ways that the family can access this if they choose to. We always tell them, like, this is for you to have. If you never listen to it, that's okay. It's here if you want it. And I think that's one of the services that we've been able to provide, and a big acknowledgement to the Pediatric Advanced Care team for helping us coordinate that. Speeding through. Here you go.
Thank you. Yeah. And finally, let's take a look at music therapy with our neurodivergent populations. Children are often coming in maybe with a medical diagnosis, but it's paired with diagnosis of autism or ADHD, intellectual disabilities, and global delays. We get to use that structured nature of music once again to create predictable patterns and as many opportunities for expression, choice making, whatever the skill set might be that we're trying to work towards, embedding these opportunities for the patient to engage. In this 2014 study by Dr. Lagasse, she was looking at a group of children with autism and communication skills, and she compared a music therapy group with a social skills group using different interventions that we've talked about in music therapy. And as you can see, there were significant improvements in the music therapy group compared to the social group, including eye gaze and joint attention. As we are understanding more about autism, and it's a very important, there's very important implications of the way that music is able to affect these skills in our young folks. There's something unspoken when we're using music. It could be as simple as bum ba-da-dum bum bum bum. It's just automatic. It's just natural, and we are using that priming of our cultural understanding as a quick way to prime the brain and create these successful experiences. I don't even have to use any words for you to understand a social experience through music. It can be as simple as no words necessary. And instantly we have a shared experience that we feel successful about and we connected through. And all of a sudden we're on the same page here. So Maggie and I have been seeing these changes happening in real time, and thought, hey, what's going on from our patient and family perspectives? We'd love to hear from you. So we created these feedback cards. And so it says, after music therapy today, I feel, and as you can see, this was written by the parent or caregiver, grateful, happy. My son had so much fun singing and playing musical instruments during music therapy. It was a fun way for him to move his body and stimulate senses while still being able to stay in bed. Thanks for a great program.
And so we want to take this time. It's the morning. We've been sitting. We've been giving you a lot of information. We will be doing a music break. You can stand up. There will be some 3 directions. They will be stand up, sit down, and turn around. If you do not want to stand up, you're like, no, thank you. You can put your hands up. You can put them down. You can spin them around. Whatever works best for you. People on Zoom, you're welcome to join us as well. And this is a little movement song about a troll. There once was a troll who guarded a bridge, but he didn't let me pass till I did what he said. And his special request, get ready, went something like this.
Stand up,
Turn around,
sit down, stand up, sit down, stand up, and turn around. And now, sit down, stand up, turn around, sit down. And just like that, you'll find that a child who has a lot of struggles following directions or staying on task is hanging on every word.
It's tough, right? And I'll tell you, sometimes we do like the Matrix version, the slow-mo version. We do all kinds of things. We can change it to the drums. We can really adapt it, like we said, to be in bed and to be accessible for what's available and interesting to each child. Notes, qualitative notes analysis. So we want to give a big shout out to Dr. Carissa Wengrovius, an assistant professor in the kinesthesiology physical therapy department, and Izzy Fisk, a student of neuroscience and music at the University of Vermont. We have been so fortunate to be connected with them through their interest in integrative arts and music therapy. And they were able to look at all of our notes from the last year. We're not able to document an ethic yet, but we're still, as part of our standards of clinical practice, documenting our patient interactions. So they looked at a selective sample between February of 2024 and December of 2024. And Izzy coded 184 of the 344 music therapy notes. We were really interested in, like, what are the most common goals we're addressing? Like, what are some of these themes? And then what are some of those common patient responses that we're documenting? And what we found were 4 larger categories, kind of overarching categories for the notes. So with support, with navigating the hospital environment, that might include normalizing the hospital environment using, right, those familiar songs. You know, patients and families would be like, oh, they love this song at home, or like, this is the song I sing to them every night when they're going to bed. Providing pain management, increased relaxation, distraction, that procedural support we talked about, and then increasing and decreasing alertness, all kind of fell under that larger category. There were opportunities for communication and expression that might look like self or emotional expression. It might be promoting communication, both verbal and nonverbal, and then increasing opportunities for autonomy and choice making. Music therapy is not a have to. You can always say no. And Dan, and I always tell them, it does not offend me. It's okay. It might be the only thing they can say no to that day. There are opportunities for developmental activities, both kind of a general developmental activity for maybe patients, and especially our little patients that might have extended hospital stays or have had extended hospital stays in the past. And then maybe more specific targets like motor activities if a kid comes in and they're maybe need to do some more like movement-based, or we worked on some standing with some of our kids that are like right on the cusp of being able to stand. And so using some of that time to work on some of those developmental activities. And then providing family support and respite. These were notes that detailed specific family interactions within the family where they interacted with the patient. Our patient responses, the 4 that came up the most were a bright affect or increased mood. I think we've observed that today in ourselves. Increased autonomy, increased family interaction, and then expressing an interest in music therapy and really being engaged. A couple more comment cards. The top one is from a parent and caregiver, and it says, after music therapy today, I feel happy and comforted. This helped my son smile and want to engage with all the different instruments. This is a great program, and we are so thankful for the opportunity to have it. And then a patient was calm and rejuvenated after music therapy. We also did a staff survey of Baird 5. This was another opportunity for us to collaborate with Dr. Wengrovius. We emailed the Baird 5 staff, and we just kept it to Baird 5. We do go to the PICU, but just for ease of implementation of the survey. And we got about 25 responses over 3 weeks. 50% were our nurses, LNAs, RNAs, NPs. 42% were doctors and physicians. 4% of respondents were from child life, and other professions made up the remaining 4%. 83% had observed a music therapy session. During the staff survey, we also asked questions about, you know, what kind of goals you saw most commonly addressed. And so knowing that 83% had observed a session, we felt like it was, these people had seen us at work and they were able to answer some of the following questions. So when we asked staff about the goals, we put it on a Likert scale, a 5-point Likert scale from never, rarely, sometimes, frequently, and always. And the top 4 goals, or more than 4, but the goals that had over a 4% average response. So we're falling within that, between frequently and always. There, people are saying, we're seeing you work on these goals. We're increased positive social interaction. So that was, the average was 4.52 for the response. Improved mood, decreased anxiety and increased relaxation, normalized environment and increased self and emotional expression, increased developmental activities, and increased communication opportunities. And when I was looking at these results, I was like, wait a second, I just read these in the qualitative notes analysis. And so what Danica and I are writing about in our notes, right, is similar to what people are observing us doing. So I feel like it's this idea of like, are we doing what we think we're doing? Do people think we're doing what we're doing? And so kind of seeing, are we aligned with what's happening in the music therapy program? So we also had comment staff reflections. Danica and I know what happens during music therapy. We're usually there. And so, but we also wanted to know, what do other people observe and see? And some of the comments, they talked about the increased engagement, the decreased irritability and pain, the increased relaxation, more energy, a brighter affect, and the smiles came up a lot, as we've noticed. And then I think this quote really stuck out to me. Sometimes it's the only time they are engaged during hospitalization. So this is what we're seeing staff reflect on music therapy services. Danica and I, when we're gone, we're gone. We're not on the floor. And so one of the questions we had was, what do you notice after? What are the impacts of music therapy after we leave? And they said the effects can last for hours or reset the entire admission. The climate of the floor is altered by music therapy. Some of the comments talked about, right, it goes from this clinical environment to this supportive and kind of holistic healing environment when we're there. They notice an increase in cooperation from patients doing care later in the day. So not even care that's happening during music therapy, but patients are more cooperative with other types of medical care that's going on after we've left. They noticed it was easier to build rapport with patients. That could look like, maybe they got to be in the music therapy session and jam to the same songs and realize oh my gosh, actually, we both love John Bon Jovi. This is amazing. Or maybe they're just able to ask them about music therapy and the patient's like, oh, let me tell you, right? It's just this shared experience that Danica has mentioned, right? We're looking at how this impacts the whole unit, both the family unit, the patient, and the staff. And then parents were more willing. People talked about parents being more willing or able to engage in medical discussions and decisions after music therapy. And this was not one that I expected, kind of caught me by surprise. And these comments were around, parents expressing that after music therapy, they were able to take a moment and then be able to engage in those medical decisions.
So Maggie and I have been here trying to give you the best idea of what music therapy looks like without you actually being in a session. We've reviewed some of the research and the applications that we bring here at the hospital. And we'd like to acknowledge all of you here at the auditorium and on Zoom for committing to a better understanding of what music therapy is and how it's impacting our community. This is our 1-year celebration of 10 hours of music therapy per week. And we can't help but kind of see ourselves wanting to raise the bar. So in looking to the future, we'd love to see an increase in number of patients receiving music therapy, more opportunities to work with team members, increased measures around data collection, and build more awareness. And through the limitations of our current funding, we have also figured out some actionable items to improve effectiveness within our scope today. And so thinking about ways to create a protocol around patient prioritization, how to get more hours. And as Maggie mentioned, we are working towards having our presence on Epic for more of those opportunities to collaborate. And so in conclusion, we did it. In conclusion, we are whoever this music is reaching is impacting them, whether it's patients, family members, or staff members. It's rippling out into the community as families are sharing their stories and feeling willing enough to give us feedback in the moment. These are lasting experiences that go on beyond their time here at the hospital.
So we've seen improved perception of hospital experience, elevated mood, improved patient and staff interactions, decreases in anxiety and stress, and better pain management through non-pharmacological methods.
So whether we're rocking out to some Taylor Swift with a teen who's just trying to make it through the day, or soothing a stressed mother and their crying baby with a familiar nursery song, we are changing the story of the patients that we see with just one music therapy session.
We want to say a big thank you to the Osher Center for Integrative Health. Our nurses and staff at Verify, we literally could not do this without you. And then Dr. Carissa Wayne-Grovius and Izzy Fisk for help with all of our notes and our surveys.
We gave you a lot today and would love to hear if anyone has any questions. Really opening this up to be a conversation to figure out ways to create a better effectiveness with our program. Yeah.
It's always the last row. If I'm broken, I'm coming, sister. I'm coming.
Thank you so much for this talk. This is really inspiring. I was fortunate enough or old enough to know Laura Mann, who inspired all these, and she'd be very proud. So that's great. My question is regarding whether you've integrated into the community for like early intervention. I work with the complex kids once they leave the NICU, and I have a lot of parents whose child's needs evolve from discharge to the first 3 years. And they often need some other modality that's not so medical. Their child becomes this medical experiment as opposed to this child. And this seems wonderful. I've had one family that's been able to pursue it, but they've gone to Boston. I don't know if you know if there's some opportunities for my families to reach out and get this.
Yes. So we're really fortunate to have some music therapists other than ourselves in the house right now. And I do know that some music therapists in the Chittenden and Franklin County area provide like some daycare-based groups. I don't think there's any specific funding from early. I'm looking at people to see if they'll to correct me. Early childhood ed. I think in the larger context, we are looking at a state recognition of the music therapy credential in order to protect consumers. And that may also provide some increased access to families, because you're right, it's really important. I know that in other states, music therapy is part of early childhood intervention, and it can be an IEP service at schools. But I don't know of a music therapist that's directly working Head Start.
Providing
Thanks so much for your talk, and I totally support what you're doing, and the way it's evolved is wonderful, and the professionalization, like could it get music therapy into health insurance? I wonder about the side effects or there's other people who have brought music in and how you integrate with them, or the idea of if you haven't had the proper training, watch out or something? I just want to know your sense of the boundaries there.
Well, advocacy is a daily act of service to our to our profession, because there are a lot of question marks of, is this just the music lady or is this music therapy? And so when we're working with patients of different populations, and using music as a tool to achieve their goals, that's going to be the difference between music as entertainment versus music being used in a therapeutic way.
And I'd like to add, that's such a great kind of explanation about when you talk about the continuum of care. And sometimes I like to compare it to like our physical health, right? There are physical therapists and, group runs, or like getting together with your local soccer team and doing like some soccer games. And so I really think about matching what the person needs with that level of intervention. And so thinking about like, when do you refer someone to a physical therapist? When is it, oh, you know what? I actually think that maybe the right avenue for me is finding a local running group. But that's going to be for some people. And that's what we want people to think about with music therapy, is that we are matching the need that we see in our patients with the qualifications and training. And so in settings like the hospital, where we have to where we see patients with maybe altered mental status, or there's going to be drug, medicines and impacts that's going to have on their ability to engage, or our neurodivergent populations that maybe are really sensitive to music. The more you have to manage, it's always a good idea to think about what kind of training and experience does somebody have with working within these populations and in these settings. That makes sense.
Hi, it's Kate from PACT. I just want to say thank you for this presentation and for all that you do for our patients. From a serious illness standpoint, like, we see that music therapy helps with symptom management in a really significant way. I have very recent memories of Maggie on the 7th floor with us with prenatal patients, in people's homes at the 11th hour on a Sunday afternoon as a patient is nearing end of life, recording memory making. Just this week, our team's been advocating for a sibling to get outpatient music therapy to cope with the vicarious medical trauma they're experiencing alongside their brother who has cancer. And just yesterday, I talked to an outpatient music therapist on the phone about how to help a longstanding patient manage some of their self-harm behaviors as they move through adolescence with severe neurologic impairment. So the applications are just enormous and so incredibly helpful. And I guess if I'm allowed to have a moment of advocacy, I would say some is good, but more is better, because for patients with serious illness, you can imagine like one session is great, but continuity inpatient and outpatient and access on a daily basis to really dive deeper into how this can help with symptoms and goals of care is really important. So thank you.
First of all, I just want to say thank you guys so much for everything you do. I think resoundingly, we can all agree that you guys make such a difference, and just pouring things from the chat, pretty much saying the same thing. And I think it really reflects on the questions that people are asking, but pretty much is for music therapy used in other areas of the hospital, other patient care populations, I guess, outside of just the children's hospital setting, if you're aware of any.
Sure.
Are adults getting this?
Yeah.
Yeah.
There is a music therapist employed by the hospital who's working in adult inpatient psych. And so we want to give a little shout out to Keegan Fike. And so that is happening. There are music therapists in private practice around Vermont. I would say one of the ways you can think about it is, if there's a nurse that ever works in that facility, there's probably a music therapist that has worked in that facility. So there are music therapists in schools, in hospitals, in early childhood ed, in hospice, in memory care. There's community-based music therapists, forensic music therapists.
Yeah. Prisons and community centers.
We are just one other question. We didn't talk about the newborns, but there was a series of studies about playing Mozart relative to other versus rock music in the NICU, relative to what it did in terms of physiologic improvement, emotional stability. Any thoughts on since they can't choose the music, what we do in the NICU and should it be there?
All right. So, as Dr. First mentioned, I did the NICU music therapy training at Florida State, and there's another rhythm breath lullaby training that Dr. Joanne Lowy does at in New York.
Mhm.
And their music therapy research really focuses on their recommendations are simple music, stepwise motion. We're talking about the actual musical elements, and in certain keys. They've researched that that is most non-alerting for our NICU patients, especially if we're working on them developing that sensory tolerance and being able to kind of deal with all that sensory information they're getting. And so in music therapy, that's what the literature supports. We, of course, are able to take songs of kin and really preferred music. And we, like, because we're musicians, we're able to put it in a setting, in a key, adjust the tempo and do it live so that we can use, patient preferred or really important family
You can
music.
see what's happening.
Yeah, exactly. And that way, like, we're able to manage the music and then adjust to any responses we see from the infants.
So you sort of mellow out the Metallica.
I mean, nothing, there's some great ones in there. Sweet Child of Mine makes a great little lullaby. And so I think it's this idea, and of course in the future, right, we can build those neural connections so that they're able to tolerate that stimuli. But in the NICU, especially, we're thinking about how can we make sure that we're keeping everybody, happy and healthy, and as supported as we can.
Well, I would speak for all of us and everybody out on Zoom to thank both of you and just thank you for raising our awareness, showing us that you are also looking at the science and the art of music therapy and what a difference it can make. So thank you, Maggie. Thank you, Danica. Thank you, everybody. And again, thank the OSHA team. And
Feel free to reach out to us if you have more questions or ideas.
and the Laura Mann crew who made this possible. All right, everybody have a great week.
Yeah. Yes. Thank you, Dr. First. Thank you so much.
Thank you guys.